Hello everyone, welcome to my channel, and in today's video we will discuss DNAR counseling. So DNAR stands for Do Not Resuscitate, and it's a very important topic not only for the purpose of exam but also in practical life, because when you are working in the NHS you will be required to have this discussion on almost daily basis with either patients or their families. Okay, so DNAR stands for Do Not Resuscitate, and like every other medical treatment, this is a medical decision. So it will be your consultant who has decided that a particular patient is not for CPR. Okay. This is because, like every other treatment, we do CPR in the patient's best interest. But sometimes we'll have elderly or frail patient or patients with, terminal disease, for example, metastatic cancer or advanced dementia or massive stroke. And we think that even if we do the CPR is not going to be successful. Okay. Or if we were able to, bring the patient back and CPR was successful, the patient will be in, worse state because when you are doing the CPR and the heart has stopped beating and you are doing the CPR to restart the heart, in that time the brain is not receiving any blood supply at all and there is going to be hypoxic injury. So quite possible that when you bring the patient back, they are in a vegetative state. Okay. So you will be either having this discussion with the patient himself, him or herself, or you will be having this discussion with the patient's next of kin. Okay, so there are these two possibilities. So sometime, because DNAR is an anticipatory decision, we have to decide in anticipation that if a cardiac arrest happened, we will not be doing CPR. So sometime the patient might still be of sound mind, the patient might still be oriented, and you can have this conversation with them. Okay, so let's suppose we have a patient of metastatic lung cancer who has been diagnosed, in this admission, and for example, they came with a cough, and we did a CT scan and we found out that there was lung cancer with mets, and the patient is still oriented and the patient still has capacity. So you will be discussing DNAR with the patient himself. But for example, we have a patient who presented in a drowsy state, okay, and we found out that he has lung cancer with brain mets. Now the patient, he is drowsy and he's unresponsive and can't hold a conversation. Or you have an advanced dementia patient who is not able to, who does not have the capacity, mental capacity to understand and retain information. So you'll be discussing the information with the patient's next of kin. Okay. So there are two possibilities. You are either talking to the patient or you are either talking to the patient's relative. In both situations, it's not going to be easy because it's a very sensitive discussion. So we'll start by explaining that you are here to discuss their future care plan with them. Okay. So to start by saying that I'm here to discuss your future care plan with you, or I'm here to discuss your date's future care plan with you, and say if that would you mind if I ask you a few questions about his health condition, and then start by taking a brief history about the current illness, when was it diagnosed and how the disease progressed, and what treatment did they tried, and all the events leading up to this current admission. Okay. And then ask about their general health condition. So general health state of the patient and the number of admission in the past 12 months. Okay. So by asking this question, you have now an idea of their disease condition and about how advanced their condition is now. By asking about their general state of health and number of admissions in the past 12 months, you are trying to ascertain the quality of life of the patient. Okay. So if this is a DNAR patient, so most likely their current illness will be quite advanced. Okay. And the disease will have progressed despite all the active treatments and everything. And their general state of health and quality of life and number of, there will be repeated admissions, and their quality of life and general state of health will not be, will be poor. Okay. You will also need to ask about their mobility, whether they are able to do activities of daily living or whether they need help with all the activities, including, eating and washing themselves. So again, you are trying to ascertain the quality of life of the patient. This is because you are trying to, by asking these questions, you are trying to establish the patient's quality of life. So the patient's quality of life is so poor even now. So after their cardiac arrest, if it happened, and you were to do CPR and you were able to bring them back, you will be bringing them back in a worse shape than right now. And if their quality of life right now is not so good, then it's going to be even worse later on. Okay. So, and then you will ask some questions about social history, where do they live, who do they live with, any package of care, etc., who takes care of them, who is in the family, okay, family support, etc. And if you are talking to the patient's relative, you need to establish a few things. You need to establish whether they are the next of kin, because these discussions need to be done with the next of kin. We don't talk to anyone else. Like if somebody's next of kin, most likely it's going to be their kids or their spouse. So you won't have this discussion, for example, with their niece, okay, or with their uncle if they're not the next of kin. And then you'll need to ask who has the lasting power of attorney. Okay, so lasting power of attorney is for those people who, like, people nominate somebody as their lasting power of attorney in case they lose their capacity. For example, dementia patient, they usually appoint somebody with the power of attorney for to take medical decision if they were to lose their capacity. Okay, so you need to ask who has a lasting power of attorney for health. Okay, because lasting power of attorney can be for other things as well, like for example for wealth, to take financial decisions. But here we are concerned with lasting power of attorney for health, because this person will be taking all the health related decision for this patient. Okay, and you will also ask about advance directives. So advance directives are patients wishes who are documented down regarding their future treatment, and these advance directive are legally binding. So for example, if you have a patient who has presented with upper GI bleed, for example, you have an Alzheimer patient who has presented with upper GI bleed, but the patient has an advance directive in place that you won't that they won't like any invasive investigations like endoscopy, then you can't do upper GI endoscopy on this patient. Okay. So advanced directives are legally binding. So you need to ascertain these three things. Who is the next of kin? Who has lasting power of attorney? And are there any advanced directives? Okay. Because if they are there, then you will need to decide the future care plan around these advanced directives. Okay. Now here the discussion is about DNA CPR. Okay, so you'll start by saying that thank you for answering all my questions. This was very helpful. Now there is something important that I would like to discuss with you, and it's about CPR. Have you ever heard of the term CPR or resuscitation? Okay, they might they might don't know anything about it, or they have might have some faint idea by watching some TV shows, etc. So you need to check this understanding. If they say yes, I know what CPR or resuscitation means, then you will, you'll still need to check their understanding. So you will still ask them, do you mind explaining to me what you understand by CPR or resuscitation? Okay, because you need to ensure that they have the correct understanding of CPR or resuscitation. But if they say, no, doctor, I don't know anything, I've never heard of the term CPR, then you'll explain it to them. You'll say that CPR is a form of treatment that we apply when someone suddenly stops breathing and their heart stops beating. Okay. In other words, if someone suddenly pass away. So when the heart stops breathing and when the heart stops beating and the lung stops breathing, like in layman terms, the person has passed away. Okay, they are no more breathing and their heart is not beating. You can't find a pulse. So I'll tell them that CPR is a form of treatment that we apply when someone suddenly stops breathing and their heart stops beating. In other words, if someone suddenly pass away, okay, then we apply this treatment. It's quite aggressive and it includes four things. Number one is aggressive compressions on the chest to restart the heart. Okay, a tube down the throat to help with breathing, electric shocks across the chest, and some medications through the vein to help the heart restart. So by doing all this, what we are trying to do is we are trying to bring the person back to life. Okay. So it's very aggressive, but it's only successful about 20% of the time, even in young, healthy people with no other diseases or comorbidities. For people who are elderly and frail and have other medical conditions, the chances are even lower. Okay. So based on your current health status, or if you are talking to patient relative, then you will say, based on your mom's or dad's current health status, we are concerned that resuscitation might not work. Okay. And even by small chance, if it worked, we might bring them back in a worse state, thus causing more suffering or harm. And as every treatment is carried out in the patient's best interest, we feel that CPR is not in the in your best interest or your mom's or dad's best interest. Okay. So at this point, you need to check their understanding again, whether they are following you, what are their thoughts and feelings about this, do they have any questions? Okay. And then you will tell them that based on these concerns and after carefully considering your health situation or your mom's or dad's health situation, the medical team has made the decision that we won't attempt CPR if your heart or breathing were to stop. Okay. But then you'll need to explain it to them that this decision, the DNAR, only apply to CPR and only in the worst possible scenario where their heart will stop and their lungs will also stop. Okay. Other than that, you will be treating every other medical condition. If they develop an infection, you will give antibiotics, you will treat their diabetes, you will treat their hypertension, you will treat everything. Okay. But the end stage where their heart will stop and their lungs will stop breathing, you will not try to restart them. Okay. So it's only when things go to that stage. Okay. So you need to bring this point home to the patient because many people, when you tell them we won't be attempting CPR, they feel like you are totally giving up and you are stopping all active treatment. Okay, so you need to make sure that the patient or the relative, they understand this point. Okay, so tell them that I want to reassure you that this doesn't mean we won't treat any medical condition that you have or we are giving up on you. Okay, we will continue treating every medical condition that you have and continue to provide the best possible care. Okay, and the end acknowledge that this was not a very pleasant discussion and it was, it would be very hard for them to, discuss this thing with you. So tell them that I understand that this can be very hard to hear and it's not the most pleasant conversation. However, I'm here to answer all your questions and support you in any way that I can. Okay. So this was all about DNA CPR, and then I'll make another video about palliative care discussions because palliative care discussions are different from DNA CPR, and many people they confuse the DNA CPR and palliative care. So I'll make another video on that soon. If you found this video helpful, please subscribe to my channel, and if you have any questions, please ask me in the comment section, and I'll see you soon with the next video.